Hi everyone, welcome back to my YouTube channel. I'm back with another video on what Medicare has proposed for telehealth services, medical nutrition therapy, and physician assistant services for the calendar year 2022. Let's talk about telehealth services under the physician fee schedule. As CMS continues to evaluate the temporary expansion of telehealth services that were added to the telehealth list during the COVID-19 public health emergency, CMS is proposing to allow certain services added to the Medicare telehealth list to remain on the list till the end of December 31st, 2023, so that there is a glide path to evaluate whether the services should be permanently added to the telehealth list following the COVID-19 public health emergency. Section 123 of the Consolidated Appropriations Act 2021 or CAA removed the geographic restrictions and added the home of the beneficiary as a permissible originating site for telehealth services when used for the purposes of diagnosis, evaluation, or treatment of mental health disorder, and requires that there be an in-person, non-telehealth service with the physician or practitioner within 6 months prior to the initial telehealth service and thereafter at intervals as specified by the Secretary. CMS is proposing to require an in-person non-telehealth service be provided by the physician or practitioner furnishing mental health telehealth services within 6 months prior to the initial telehealth service and at least once every 6 months thereafter. CMS is seeking comments on whether a different interval may be necessary or appropriate for mental health services furnished through audio-only communication technology. CMS is also seeking comments on how to address scenarios where a physician or practitioner of the same specialty/subspecialty in the same group may need to furnish a mental health service due to unavailability of the beneficiary's regular practitioner. CMS is also proposing to amend the current regulatory requirement for interactive telecommunication systems, which is defined as multimedia communications equipment that includes at a minimum audio and video equipment permitting two-way real-time interactive communication between the patient and distant site physician or practitioner to include audio-only communication technology when used for telehealth services for the diagnosis, evaluation, or treatment of mental health disorders furnished to established patients in their homes. CMS is proposing to limit the use of an audio-only interactive telecommunication system to mental health services furnished by practitioners who have the capability to furnish two-way audio and video communications, but where the beneficiary is not capable of using or does not consent to the use of two-way audio and video technology. CMS is also proposing to require use of a new modifier for services furnished using audio-only communications, which would serve to certify that the practitioner had the capability to provide two-way audio and video technology, but instead used audio-only technology due to beneficiary choice or limitations. CMS is also soliciting comment on whether additional documentation should be required in the patient's medical record to support the clinical appropriateness of audio-only telehealth, whether or not they should preclude audio-only telehealth for some high-level services such as level 4 or 5 evaluation and management visit codes or psychotherapy with crisis, and any additional guardrails they should consider putting in place in order to minimize program integrity and patient safety concerns. Now let's talk about the payment for medical nutrition therapy or MNT services and related services. The statute provides coverage of medical nutrition therapy or MNT services by registered dietitians and nutrition professionals when referred by a physician and also establishes the professional qualifications for these practitioners. Since January 1st of 2002, registered dietitians and nutrition professionals have been recognized to provide and bill for MNT services, meaning nutritional diagnostic, therapeutic, and counseling services. For calendar year 2022, in response to stakeholder concerns about parity with other types of non-physician practitioners, CMS is proposing to establish regulations at Part 410, Section 72 for their services, since they are the only non-physician practitioner type listed as Section 1842B18C of the Act without a regulatory provision in this section of 42 Code of Federal Regulations Subpart B. CMS is also proposing to update the payment regulation for MNT services at Part 414, Section 64 to clarify that MNT services are and have been paid at 100% of 85% of the physician fee schedule amount without any cost sharing since calendar year 2011. While CMS implemented this change through their usual change request process, they neglected to update this regulation when the Affordable Care Act, or ACA, of 2010 amended the statute to accept the coinsurance and deductible for preventive services defined under Section 1861DDD3 of the Act that have a grade of A or B from the United States Preventive Services Task Force, and MNT services received a grade of B. Regarding physician assistant services, CMS is proposing to implement Section 403 of Division CC of the Consolidated Appropriations Act 2021, or CAA, that authorizes Medicare to make direct payment to physician assistants for professional services they furnish under Part B beginning January 1st of 2022. Medicare currently can only make payment to the employer or independent contractor of a PA. Consequently, PAs could not bill and be paid by the Medicare program directly for their professional services. They also did not have the option to reassign payment for their services or to incorporate with other PAs to bill the program for PA services. Beginning January 1st of 2022, PAs would be able to bill Medicare directly for their services and reassign payment for their services. With the reference slide, I conclude my presentation. Hope you enjoyed this video. If you found this information useful, please consider subscribing to my channel. Thank you for joining. Bye now.